Right on. Okay. I think it's working. I'm just going to talk anyways. Um, I want to tell everybody about some of the things I learned in the last couple of days about the drug supply. Uh, the main thing is that it's the mode of production has changed for the down, and it's the final product is being produced locally, and it's being produced locally several steps up the supply chain. Um, Again, domestically, this has changed the nature of it dramatically. Uh, Last week, or 2 weeks ago, when the coroner released the May report with 170 deaths in BC, which is, I mean, it's the highest. But it is going to get higher. It's going to get worse. It's going to get a lot worse, um, unimaginably so. And this problem is not just local to the downtown east side or to Vancouver or to BC. This is went all over the country really, really fast. Why? Pandemic. So, being produced domestically, we've learned a lot of new things. That first of all, we can distinguish between this current product and the imported product, which was, after all, produced in a you know a a laboratory factory, mass like large scale production. What's being done now is clearly much more small scale, and what I've been describing it as is um, small batch, um, localized production by inexpert, self-taught chemists on with non-professional grade equipment. So what that means is that its consistency is dramatically different. What I learned from the coroner's office, um, who are, who have been solid, actually, in terms of their, they're the only ones in the country who are reporting monthly in detail. If every province was doing that, I mean, we'd at least have numbers, unlike where, the national reporting is quarterly and really vague and ridiculous. When you consider what's being reported daily in the other emergency, whatever the hell that is. Sorry. Um, so what I've learned from the toxicologists is that it's the consistency that's a huge issue right now. If you think about what was being produced before, that was smooth peanut butter. Okay, what's being produced now is crunchy peanut butter, and sometimes with a whole peanut in it. Do you know what I'm saying? Okay, so there's these unmixed, unchemically bonded hot spots, which are 3 and 4 times the potency and the concentration of the rest of the mix. That's why that's why people who have a lot of tolerance and a lot of experience using fentanyl in whatever combination are overdosing because that's how powerful it is. 3 to 4 times as potent. So it's not, and there's nothing, you can't see it. There's nothing you could actually distinguish that from anything else. That's why and it's these small batches, and everything is like that because nothing's coming in. The precursors are, in some cases, I'm pretty sure, because the mix, there's these combinations of synthetics in the mix, a lot of them, but it's the final product, and this is changing throughout the supply chain. So that's, and what are we going to do about that? There's nothing you can do about it. Really? Well, that's motivation for safe supply. This is not going to magically improve. We seem to be relying an awful lot on magic, and that's not going to help. So that's when you're talking about advocating for safe supply. That's a very, very compelling point. It's not going to get better. It's going to get worse, and the way it's getting worse is deadly. So that's one. Other things we know about them, for probably more in different places. So please, let each other know. We have a guest ban in all public housing in BC, and single resident housing. So they, it's a grotesque joke where they say don't use a loan, but no guests. So and if your imaginary friend, you can't do. What are you going to do about that? We've been at this for 2.5 months now, saying this is a, if you want people in housing, but housing is a total death trap. Where you're supposed to, oh well, I don't know. I mean, and just pointing out here, the fact is that they've made a calculation. The housing providers have made a calculation that if there's, if you a death by overdose is not infectious, but COVID is. So who are they protecting? Not us. That's right, the staff. Other things. So you're not guests. You've got to be alone. Also, why do we have overdose prevention sites that are, available 12 hours a day, 14, whatever? We need to get creative about this and find ways to keep each other safe 24 hours a day, because that's where people are. Other points I want to make quickly is that so we've got through more or less the first wave, and I just want to be clear about this one too. It's not over. We're at the end of just the beginning. How long is it going to go on? Nobody knows. Why? It's a new virus. We don't know what's going to happen, and anyone who says they do is full of shit. The next point, the point about that is we are learning every day. So one important thing here is that you're actually safer you're actually better off in terms of protection from the virus outside. If you're compelled to be in a congregate setting like a group home or a shelter or a hospital, inside, that is very, 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 very risky. Your chances are better of remaining healthy if you're outside on your own with a tent than you would be inside with a bunch of people. And you're probably, as we know, you're going to be safer, you're going to be more likely to be revived from an overdose if you're outside near people than you would be inside by yourself in your room with nobody. And, so we've seen that play out here in the downtown east side dramatically. I'm still trying to figure out how many people died last month, not of overdose, but of everything else that we die from. It was extraordinarily, terrible. And that's, death is death. And these are all deaths by injustice. So, bearing that in mind, how do we take care of each other in a outdoor setting, keep eyes up on each other, and yet, keep safe from the police? The most dangerous thing you could be doing if you're outside is get chased around all over the place and get evicted again and again from public space. So that's something to think about and strategize around, because, here, the buildings are so hot and filthy and dangerous that a lot of people do spend a lot of time outside in the hot summer, and why the hell wouldn't you? Are we seeing carfentanil? In Edmonton, a lot. I think that one ranges from place to place, but bear in mind, that's just an analog, so that's going to change over time as well. Take the police supply. Well, remember, May 5th, they did that big bust down here, and they took a lot of material that was about to be processed. So yeah, when they made that bust, they definitely set a lot of people up for a down you don't come up from. Let's see. Are you safer outside with using? If you are inside by yourself, yeah, you are safer outside around somebody. Keep an eye on you, And the other thing that I'm seeing here, please let me know what's going on. We are seeing fentanyl contamination, opiates in with speed. And that's not something that happens a lot here, but was it a simple cross-contamination? Don't know. Couldn't get the details. Thanks, BCCSU. Permitting encampment with ops. What I've been suggesting is that trailers, half of them a bathroom, the other half OPS, uh, on sanctioned campsites. I mean, if you are going to be outside, that should not be a death sentence, and it doesn't have to be. So instead of waiting for shit to happen, let's actually anticipate how this is going to go. I mean, for Vancouver at least, I can anticipate that more and more people are going to be outside, and let's not get chased around. Let's find a way to use public space creatively. How about city parking lots? How about this? How about that? We've and like in terms of public space, we need to have running water. We need to have bathrooms, and food and things like that. Washing your hands is an absolute priority. We've got several different things coming at people, and washing your hands, keeping your eyes on each other, clean materials, clean supplies, and you know, if we're doing drug checking, we're not so much checking if it has fentanyl because we know it does, but we are checking to see what the range of contaminants are. I had a list that we got together. I was very happy to get this information. There's we did just samples of the down from the beginning of March to the end of May. There were over a list of like dozen different things. I mean, it's synthetic, right? Which means it can be made. It's not from anywhere. It can be made anywhere. This is just chemicals, right? So there's all kinds of crap in the mix. It's just a soup of mess. So, I mean, I think that being around somebody, not using alone, finding a way, whether you could do online, you could do all kinds of things, but we've got to find a way to do that. And frankly, we've got to find a way for make these housing our own instead of being constantly compelled to do these, to put ourselves in danger in our own homes because of the rules. It's not a home. That is a trap. So it makes perfect sense to me why someone outside is going to say, well, no, I'm not accepting that. I refuse that housing. Well, of course you do. Of course you do. Like this, and to put it that way, it's like we've got to actually find solutions. We've got to get out of survival mode, even though it's as bad as it is worse than it's ever been. We've got to find ways to think past survival mode and work on actual solutions for ourselves. I mean, otherwise, we're just constantly reacting to shittiness, and we've got to find ways to make ourselves some space, because this could be several years, and I think that in terms of safe supply, I mean, we've got to create options. I think that safe supply just being this is what it is, enjoy it or whatever, or get out, that's not a choice. I think we need to find lots of different ways to do it, lots of access points. Not everyone, or very few people, are going to want to go into a clinic and into a medical setting. I think we need to get creative, and getting creative and doing our own thing is the only way we're going to push the government to do anything at all. So, yeah, ops is a total privilege of Vancouver. You're absolutely right, Shar. And you know what? Just to make that point that I've been trying to make to this stupid ass government, is that that's the provincial the order that was made in December 2016 is explicitly province wide, and an ops can be legally set up anywhere where there is need, and it deliberately does not say who decides what the need is. Very clearly, it's deliberately vague. So you do have the public health order on your side, but we have a government who's completely disinterested and doesn't want to enforce anything or even mention it, for fuck's sakes. So, I mean, what to do about that? I mean, let's talk about it later and we'll figure out a way. Same thing with the situation on the coast. There's ways to work around and make that space on public land or in a space that is your own, that is secure in some way. We got to figure this stuff out because it's not going to get better, and we can't keep running. What's the other thing? I'm concerned that in about a week and a half, the coroner's going to come back out and announce the numbers for June. I'm worried it's going to be over 200, and I think it might be. So, and the thing with this is that they know it. They know that the guest ban is going to kill people. They know it, and they did it anyways. I don't have a solution for that other than keeping at it. My other solution, frankly, is we got to take over the buildings ourselves. It's bad. Let's please try to stay in touch. I don't know. I'm worried about the situation in Toronto. They have 50 deaths in 2 months just in the city. It's just extraordinary. I mean, I've been calling it lately a prohibition massacre. It's like, well, at this point, it's like, are you okay with public massacres? Are you guys okay sanctioning it, the public? You're good with this? You're just going to get a bunch of kids, just kill them in the streets? Okay, good. Just wanted to check. I mean, at this point, what are we supposed to say? It's going to get worse.